Hey, it's Dr. Lowenstein, and I got a bunch of questions over the weekend to answer, so we're doing some videos answering those. And Christine asked, do you perform surgery for out-of-state patients? And if so, how long is the recovery, and how do you manage that process? Which is a great question, because actually many of our patients, if not most of our patients, actually travel to see us just because there's not a lot of people who do migraine surgery. And so I've got people from all over the country that come for this. And so it's a very routine situation that we do a lot. We do phone or Skype or FaceTime consultations. So patients know what to expect, and I can generally screen to make sure that they're good candidates, because it's a long trip to make if you're not a good candidate. You come in, I do some injections, make sure that we're doing the right thing and making sure that we have nerves to address. A day or two later, we do the operation, and then I see the day after surgery. And I like people to be in town for at least 3 days, but a week is ideal. But you come back in a couple of days later just to make sure that everything is, all your questions are answered and everything's looking good. But it's mostly, honestly, for patient consideration, for patients to get any questions that they have answered, so they're confident in what's going on. And then they go home. And I say, look, if you're ever in Santa Barbara, I'd love to see you again. But we do the rest of the follow-ups either by phone or in another office. So we have offices in Denver, and we have offices in Santa Barbara. And if it's easy for patients to get to one or the other of those offices to do an in-person follow-up, then that's great. If it's not, it's not unusual for me to operate on somebody and do see them right after surgery for the next couple days, and then do the rest of the follow-ups by phone. Yes, we do operate on people from out of state, and in fact, many people from out of state. And we have a very streamlined process where patient coordinators are very helpful in getting people help with places to stay here, and things to do for their family when they're here, and try to make it as pleasant an experience for everyone as possible. All right, hope that helps. Keep asking questions, and I appreciate it. All right, take care.